San Diego's most popular local morning news. Good morning, San Diego.
In this hour, we'll be talking with Dr. Brian Weeks from Alvarado Hospital, talking about allergies. Do you have allergies? You don't have bad allergies.
I don't really have allergies, but people, boy, it knocks them for a loop.
And it is the time of year, so we'll talk with the doctor about what you can do, how to keep it under control, and all that.
That'd be nice.
Yeah, absolutely.
That'd be nice. All right, if you are dreading the arrival of spring because of all the allergies,
listen up. We'll be hearing from an expert on the best ways to curb your allergies. Maybe keep them under control. Stay with us. Spring is in the air, so is dust and pollen. Millions of Americans will get allergies this spring, but don't let your allergies spoil the beautiful season. Dr. Brian Weeks from Alvarado Hospital is here this morning with some tips on how to manage those allergies. Good morning to you, Doctor.
Good morning, Dave. Thanks for having me.
First of all, I was talking to you in the break. Does San Diego have the same type of allergy season that some of the other cities has because of our weather?
That's a great question. It's kind of hard to understand sometimes how in such a beautiful place we really would suffer from allergy, but the problem that most people have is when the seasonal changes cause dramatic temperature changes. So, it's not uncommon in San Diego this time of year to have a cool evening like last night where it maybe dropped down into the 40s and then it'll warm up to 80 degrees today. That wreaks havoc on your nose and sinuses. We do have changes in humidity and the moisture in the air, which also, and then the new growth, of course, with the warming will also cause
And the
problems.
Santa Ana winds this time of year.
Drying.
Blow it in.
Absolutely. Drying, again, wreaks havoc on the ability for the nose to kind of do what it does, to make the mucus, to drain things, to kind of move the mucus through the nose normally. And when the temperature changes and the new pollens and the new things are blooming, that really does cause problems with the nasal function.
All right, we have a list of tips that people can use perhaps to help control some of the problems that they might have. And let's just talk about each one as we go through. Over-the-counter antihistamines can reduce symptoms.
Yeah, antihistamines are great. They're definitely one of our treatment armamentarium, and we start thinking about the different things that we do, and we'll kind of move through the list of things as well. I mean, I always tell people the basic way to start with good nasal care is to just irrigate your nose. Rinse it out. We have a little saying, the solution to pollution is dilution. Just wash your nose, just like you would your car once a week. Try to keep it clean. And then we move down a treatment paradigm from there. Things like topical anti-inflammatory sprays. We know, certain types of brands that everybody knows, but medications to reduce the inflammation in your nose, antihistamines, which are going to help block some of those chemicals that the body produces that make people sneeze and make people itchy and their eyes drain and red and watery and things like that.
When do you know that you need something more than just the over-the-counter stuff?
That's probably the most important question, Dave. When you're suffering from tremendous symptoms, all the time, when you start having difficulties with maybe breathing, things like asthma run very commonly with allergy. And then the other thing is really distinguishing between a chronic sinus condition as opposed to just a seasonal or a perennial allergy. Sinus conditions, usually it's color drainage from your nose. It's often severe headache associated with symptoms. Those are serious medical problems. Those need consultation and evaluation, even possibly surgery and things like that.
If it's less than that, sometimes you just have to live with some of the discomfort.
Unfortunately, allergy, a lot of what allergy is the way we're hardwired. I mean, that's the way we're built. It's the way our immune system works. Some people are more susceptible to allergy than other, and you're exactly right. Some people have to live with it.
All right, let's go back to the list. Limit outdoor activity in the mornings.
Mornings are bad because, again, it's right when that temperature starts changing, and the pollen counts tend to be higher in the mornings than they are in the evening. So I tell people, try to let the temperature kind of warm up a little bit, and it usually is better throughout the day.
If allergies conditions continue, screen for sinuses.
Yes. A lot of people think, oh, my gosh, I can't breathe through my nose, and, I think my allergies are really, really bad. Well, it's important to understand that you may be suffering from something else, a more serious condition called chronic sinusitis, and there are simple ways to determine that.
And those simple ways?
Basically, it would be a proper evaluation. We can do simple allergy testing and then possibly just a picture of your sinuses, a CAT scan or something to determine if there's actually infection or chronic changes blocking the sinuses as opposed. And, if there are, we have wonderful new treatments, minimally invasive procedures available for those types of things.
At that point, though, you really need to see a doctor about it.
You got it,
right?
absolutely.
Okay. And then see a physician if allergy conditions worsen.
Yeah, again, you don't want to find yourself getting out in the morning air and having problems breathing. Again, wheezing, asthma, those types of symptoms are often associated with allergy patients, especially severe allergic type patients.
Now, this is the season. Is there a time when it lightens up for those who are going through this?
Yep, absolutely. Typically, allergy season is thought to run, from right around the beginning of spring, which is late March, and it usually lightens around the end of May, early June. And again, that's when the weather stays pretty much hot most of the time. It'll start worsening again toward the Santa Ana times with fire season in the fall, and then it really shuts down again. So we have sort of two periods from like mid-March to June, and then from September, October, and then it really goes away at that point.
All right, Dr. Brian Weeks, thank you very much.
Thanks for having me. I appreciate it.
Thank you. Sharing your expertise with us.